Today, we're going to discuss microneedling and how it compares with laser resurfacing, either with ablative or non-ablative lasers, and fractionated versus non-fractionated lasers. I'm also going to go over the basic skin anatomy so you understand where lasers and microneedling work and where they have their limitations. I'm Dr. Joel Kopelman. I'm a facial plastic surgeon, and I've been using cosmetic lasers for many decades, and more recently have introduced microneedling into my practice. I'm going to give you a lot of insight into the benefits and limitations of each one of these technologies. For those who are new to my channel, welcome. Please hit the red subscribe button and let's get started. In order to understand how these lasers and microneedling actually work, we need to look at the anatomy of the skin. So the skin actually can be divided into three main divisions. The top layer is the epidermis. That's the layer that protects us from getting invading bacteria, viruses, and any chemicals that penetrate or touch our skin. The middle layer is the dermis. So the middle layer is critical in terms of regeneration. Specifically, the number of hair follicles you have help to regenerate skin. But there's also sebaceous glands, sweat glands, fibroblasts, which produce elastin or collagen, and pigmented cells. So this collagen-rich matrix in the dermis is critical for the support and functional aspects of the skin. This is maintained by what's called the extracellular matrix, which is produced by fibroblasts that are scattered within the dermal layer. As we age, however, these fibroblasts start to diminish, and the collagen fibrils start to break up. Instead of being nice, long, wavy fibers, they start to break into fragments. When it starts to do that, the skin starts to fold and become wrinkled. So in order to restore the integrity of the skin back to a more youthful stage, what we have to do is to microscopically stimulate the repair process in the dermis. And we do that using either lasers or microneedling. There is a third layer called the subdermis, which is really the fatty layer. And lasers and microneedling typically don't penetrate down into that layer. So lasers in general are photoselective. What does that mean? That means that there are specific wavelengths that are emitted by specific types of lasers that are attracted to certain colors or certain anatomic features. Certain lasers are attracted to water, certain lasers are attracted to pigment, and a third attraction would be lasers that are attracted to the color red, usually in blood vessels. So those lasers in general are used for different problems that arise around the face, meaning if you have wrinkles, if you have pigmented areas that you want to lighten, or if there's a lot of blood vessels that you want to try to eliminate, we have lasers specifically for those problems. Today we're going to confine ourselves though to lasers that are used to resurface the skin, to smooth out the skin, to rejuvenate the skin and bring it back to a younger, more youthful appearance. Those types of lasers fall into two different categories. Either they're called ablative lasers, which mean they remove the entire epithelium, the top layer of the skin, and then create heat that penetrates into the dermis. And there's a second type of laser we use to improve the texture and quality of the skin, and that's called a non-ablative laser. It preserves the epithelium, it penetrates through the epithelium, does not destroy the epithelium, but stimulates the cells in the dermis. So what we're trying to accomplish is actually stimulating the cells in the dermis to release a substance called heat shock protein. Heat shock protein stimulates the fibroblasts which produce collagen and repair the skin that has had this controlled injury from the laser. A non-ablative laser has the advantage of course, not injuring the epithelium. It stimulates the collagen bundles so to speak, to regenerate, but it doesn't do it to the extent that a ablative laser does. So when you have an ablative laser and you're removing the epithelium and you're delivering more heat to the dermis, you are creating more of a exaggerated healing response, which ends up to be a more robust repair of the overlying skin, and a resurfacing of that skin occurs and is long lasting. A non-ablative laser, of course, doesn't injure the skin to the same extent, but it does have a shorter healing period. It is a very fast healing period because that epithelium has been preserved. So that's the advantage of the non-ablative lasers. But it doesn't have the longevity of an ablative laser, which requires a longer period of healing. So there's the upside of longevity for the ablative lasers, but there's the downside of a long healing period where your skin remains pink and it takes quite a few weeks to normalize. So some people don't have the time or inclination to go through that long period of healing, and they want some fast improvement. The fast improvement, I mean in a matter of days, can be accomplished with a non-ablative laser. What are the ablative lasers? Typically they are the carbon dioxide laser or the Erbium Yag lasers. Those are lasers that can remove the top layer of the epithelium and stimulate the collagen. The Erbium laser doesn't deliver as much heat as the CO2 laser. The healing time is faster, but it doesn't give the longevity of a CO2 laser. The downside of a CO2 laser, however, and I mentioned this before, is that there are pigmented cells in the dermis. And those pigmented cells can be damaged by a high heat type of laser that delivers a lot of heat and can damage the melanocytes, those pigmented cells. Therefore, the skin can become lighter in color following a CO2 laser. It can lighten your skin. Sometimes that's beneficial and sometimes it's undesirable. A non-ablative laser, a brand name is called Fraxel. There are many non-ablative lasers on the market, however. That is only one of many. Laser technology has advanced over the past 30 years. And originally we only had lasers that were single beams of light. Now the technology has advanced so that there is the beam of light is again one wavelength, but it's now split into multiple beams. And what it does is preserve the tissue between each of the beams. So there's actually treated and non-treated areas adjacent to each other. Why that's an advantage is that by leaving untreated areas adjacent to treated areas, little tiny holes next to untreated holes, the untreated area actually regenerates the skin more quickly because there are hair follicles that are not damaged by the laser treatment. And those hair follicles help to regenerate the overlying epidermis. So we now use fractionated fractions. The beam is broken into fractions, fractionated lasers in preference to solid beam lasers in most cases because the healing time is much better. So now most of the ablative and non-ablative lasers that I talked about before have been developed into fractionated lasers. And that's why I use, for my non-ablative laser, it's called a Fraxel, which is a brand name for a fractionated non-ablative laser. The question is, which laser would be most applicable to your problem? That is dependent upon the individual doctor who's in front of you, because each doctor has their own methods of treating the skin. But in general, if your wrinkles are deep and you may have a lot of sun damage, you might need a stronger laser to treat those problems. One that penetrates deeper into the dermis, and therefore you might need to have a carbon dioxide laser or a erbium laser, depending upon the depth and extent of your wrinkles. In contrast, if you have mild wrinkles, if the texture and the tone of your skin is mildly affected, or you have mild sun damage, and you have minimal time to recover, then I would say a series of fractionated non-ablative laser treatments is probably preferable. It may not last as long, but the healing time is very fast and it fits into the social and professional lifestyles of most patients. Where does microneedling come into the picture here? Why did we even evolve and use microneedling in the overall paradigm of treatment here? Microneedling in and of itself was used, of course, initially with rollers. They just had needles on the end of rollers and rolled over your skin and created little bleeding spots and an injury to the dermis, and that stimulated some improved collagen deposition. But it has evolved tremendously since those days. Now, microneedling is done with automated products which go in and out of the skin to certain exact depths, so we can treat the superficial dermis, the middle dermis, and the deep dermis, depending on how we set the dials on our machines. And they've added what's called radiofrequency as well. Why that's important is it delivers heat between the little needles that penetrate the skin, and again, it's stimulating the heat shock protein, which then stimulates the collagen deposition and improves the skin quality without causing damage to the epithelium, the outer layer of the skin. So it's kind of like a non-ablative laser in some respects. However, it penetrates deeper than a non-ablative laser. And therefore, we can see collagen remodeling with a series of these microneedling radiofrequency treatments, and you can get significant improvement of skin quality and tone and rejuvenation of the skin. What all of these things cannot do, whether it's a laser or microneedling, however, is it can't lift the face. It can improve the skin quality, but it won't lift the face. So you do need to have surgery to lift the face or tighten the bags on your eyes. It'll only improve the skin quality. Now, that's a good thing because we use these devices in conjunction with surgery to enhance the final results of, say, a facelift. A facelift cannot really improve the skin quality in and of itself. It's working at a deeper layer to tighten the connective tissue and muscles deep within the skin, below the skin. On the skin surface, where there's, say, sun damage or age-related changes on the skin, you need to have a laser to tighten the skin. So you need to have microneedling to stimulate the dermis to produce improved quality of the skin, meaning the tone, a more even complexion, and smooth out the wrinkles on the face. And that will occur if you have a series of these treatments over time. Now, whether it's a laser or whether it's a microneedling, it's not a permanent treatment. It'll last a few years. It doesn't last forever, but it can set the clock back and make you look more youthful and more refreshed. If you're considering having a laser ablation, like with CO2, because your wrinkles are deep, you really have to consider what kind of skin tone you have. If you have a lot of pigmented cells naturally in your skin, those melanocytes, those pigmented cells, are going to get overstimulated by having a laser that delivers a lot of heat to the dermis, specifically the CO2 and erbium lasers, which are ablative lasers. So you have to recognize that some of these lasers are not appropriate for every skin type. So if you're a fair-skinned Caucasian patient, you're a candidate for ablative, non-ablative, or microneedling. It won't have a significant effect on what's called post-inflammatory hyperpigmentation that can occur from the stimulation of melanocytes in your dermis. However, if you're black, if you're Hispanic, if you're Asian, Southeast Asian patient, and you have a significant amount of pigment in your skin, then you want to avoid lasers that deliver a lot of heat to your skin, because they're going to overstimulate the melanocytes, and you're going to end up with hyperpigmentation in the areas of treatment. So in those cases, I would recommend that you have, say, a non-ablative laser at a low setting and or microneedling which goes below the epidermis. It does stimulate the dermis at a deeper level, but it can be controlled, and therefore hyperpigmentation is rarely a problem in darker skin types. Only big black box warning to not have any laser or microneedling treatments is someone who's had Accutane treatments within the last year, I'd say. Some people go down to 6 months, but I'd like to wait at least a year before I recommend having any of these treatments, because you can get some unusual scarring as a result of having had treatments with Accutane. We've now talked about a broad subject of laser resurfacing, the types of lasers that would be appropriate, and microneedling. If you have any further questions regarding microneedling or laser resurfacing, please leave them below. I'm happy to answer your questions. If you like what you heard today, please subscribe to my channel. We're going to grow this community together. I look forward to seeing you in my next video.